Welcome to Health and Technology TV. In this practical lecture, we're focusing on the essentials of anatomy and physiology for nursing students. Whether you're preparing for exams, clinicals, or just want to reinforce your knowledge, this 10-minute overview is packed with must-know concepts for your success in healthcare. Make sure to subscribe and tap the bell so you never miss a practical health science breakdown. Let's begin. First, what is anatomy and physiology? Anatomy is the study of body structure, what things are and where they are. Physiology is the study of how those parts function, how they keep us alive. For nursing students, understanding both is crucial. It helps you monitor vital signs accurately, understand lab results, communicate clearly with patients and providers, and deliver safe, effective care. Comment clinical ready if this is part of your nursing journey. Now let's briefly walk through 5 key systems. 1. The cardiovascular system includes the heart and blood vessels, pumps oxygen-rich blood to tissues, and removes carbon dioxide. Key terms: heart rate, stroke volume, blood pressure. 2. The respiratory system includes lungs, trachea, bronchi, exchanges oxygen and carbon dioxide. Nurses monitor oxygen saturation, respiratory rate, breath sounds. 3. The nervous system includes brain, spinal cord, nerves, coordinates voluntary and involuntary actions. Crucial for assessing level of consciousness, reflexes, pupil response. 4. The renal system includes kidneys, ureters, bladder, filters blood, removes waste, regulates fluids and electrolytes. Monitor urine output, creatinine, BUN levels. 5. The musculoskeletal system includes bones, muscles, joints, supports movement, protects organs. Key for mobility assessments, fall risk, and rehabilitation. Remember, these systems don't work in isolation. They're interconnected. A change in one affects others. For example, poor kidney function can affect blood pressure, which impacts the heart. Let's wrap up with study tips for nursing students. Use visual aids and body diagrams. Quiz yourself with flashcards and clinical cases. Practice explaining concepts out loud, like teaching a patient. Focus on understanding, not just memorizing. What's your favorite study method? Share it in the comments. Quick recap. Know basic anatomy, organs, systems, structure, learn physiology, how things function and interact, think clinically. What does this mean at the bedside? Thanks for learning with Health and Technology TV. Like this video if it helped you. Subscribe for more nursing-focused health lectures. Comment your biggest challenge in A&P. Share this with your classmates or study group. Stay confident, stay curious, and we'll see you in the next practical lecture.